Hey, what's up, everybody? My name is Dr. Daniel Choi, and I'm here to make a video that's been a long time coming. Previously, you guys may have heard in some of my previous videos about talking about my dad's case and how I basically wasted a lot of time and money on his case doing dental implants. But before I get into that, feel free to give us a follow on our YouTube channel here, and if you like the content, please give us a thumbs up. And also, you can follow us on Instagram and Facebook at North Texas Dental Surgery. All right, so let's get into my dad's case. Just to kind of give you a little bit of background information about my dad's South Korean immigrant, moved here back in '75, moved up to Northeast Ohio as a physician, and he's still practicing now at the age of 76. But he's been going to the same dental office all these years up in Northeast Ohio. And back in 2016, he was told by his dentist, like, hey, you got some issues with your bridge on the upper left and on the upper right. You have another tooth that needs to come out. Why don't you get some dental implants? And they knew that I'm a periodontist, so they said, go see your son and get some work done. All right, so let's just show you this case because it's a little easier to visualize here. All right, so this is his FMX, basically his full mouth x-rays. So you could see that he's got some root canal infections up here in his upper left. You could see that darkness developing around those teeth. And this was what they call a 4-unit bridge. And so it spanned 4 teeth, plus he had a wisdom tooth back here. And you could see the infection on this tooth right here. That's his second premolar on the upper right. So, what we decided was, hey, most people do their chewing up to the first molar. So let's just take out all these teeth right here, so that 4-unit bridge and that wisdom tooth, and we'll do a 3-unit bridge with dental implants. Take this out, clean it out real well, and in the future place an implant here, place an implant here, and place an implant here. Now, if you've seen some of my other videos, I've talked about one of my biggest enemies when in regards to like dental implants and their survivability prognosis for the future is really bad root canal infections. Really bad root canal infections are bad because they just kind of fester in that area for such a long period of time, and a lot of times that most people will not be able to know that something's going on there because they have no nerve there after the root canal, right? So when you do a root canal, you take out the nerve and the blood vessels. Well, without that nerve there, you typically can't feel any pain that there's something going on. And so what happens is that the infection gets pretty bad, and long story short, it can actually cause some implants, some dental implants, some issues if you go in too soon after the implant placement. So what we then again did on my dad's case is we had to again remove all that, clean it out, do some bone grafting, and let that heal for a while. And so what we then did was we did the 6 months later, we did the dental implant here and here. Again, we did a 3-unit bridge. And then we placed that implant on the upper right. Well, I got this x-ray in 2018, so whatever, I don't remember. Oh yeah, so May 2018, so it was, about a year and a half later. And the reason why we had to take this x-ray was because now this tooth had to come out, right? So then we took out that tooth. We had to do a sinus lift because his sinuses were way too low in this area. So we did a sinus lift and we were going to place another implant. So you might ask, why is there such a period of time that's developing between this? Well, my dad lives up in Northeast Ohio. So to get him to travel down, have some availability, we would definitely have to wait some time. So long story short, we took out that tooth. We did a sinus lift. We had to get a dental implant. So when we did that, we then discovered another issue his dentist told me about. Well, he has a 4-unit bridge here, and unfortunately, his 2 teeth here, tooth here, had a big cavity, has another root canal in this tooth. Well, we had to take out these 2 teeth, and then we were going to section this bridge right here, and we were going to have to replace the 3 missing teeth because, again, we had a fake tooth here for all these years while he had that bridge. So in the end, he was going to have 1, 2, 3, 4 teeth remaining. So let's take a look here. So again, you can see his 4 teeth remaining. He has 4 dental implants here. We cantilevered, meaning hung another crown off here, off of those 4 implants. And again, that was a bridge that he had down in the upper left, the dental implant bridge. And basically here in March of 2021, you could see updated x-rays. Now, here's the kicker. What does it look like inside his mouth? So here's the street value had he had not any insurance, what the value of everything that he did on his upper teeth. It is a sinus lift, 6 dental implants, a placement of all the, the extractions associated with all the bone grafting and membrane on all those sites, the 6 custom abutments, 7 implant crowns, IV sedations. All right, so here's my question for you. Does this look like a guy that I spent street value 35 G's on? Now, my dad didn't spend any money on this, okay? So obviously he didn't spend any money. I'm, this is, I guess, this is where your parents get you back, right? For raising you and all that stuff. They give you the guilt trip. And no, I'm just kidding. But anyways, I did all the work for my dad. But the funny, and I'm sitting here 6 years later, looking at this case, and I'm like, does this look like the smile of somebody where we spent about 35 G's on, right? And we only focus on his upper teeth. And I will tell you honestly, if that was my wife or my mouth, and I tend to not be very much of a vain person, as I'm 45 years old and I don't really seem to care too much about stuff anymore. But if I spent that much money on my wife's teeth and it looked like that, I don't know if I'd be too happy with this result. And how did it look like this? Well, all these abutments and crowns were done at different times, and so the general dentist who did this, you could see that the teeth aren't matching up properly, right? And so he has this tooth here, which is part of that original bridge, and then this is his 3 natural teeth. And you could see that on this intraoral photograph you see the recession happening on this teeth. Again, this is the natural part of that bridge that's remaining there. Well, the issue now here is in 2023, and we noticed this a year ago, my dad's teeth, those 4 teeth are now what we have class 3 mobility, okay? So those teeth, unfortunately, they're goners, right? So now we have to remove those 4 remaining teeth and then do what we call a implant bridge, right? So I'm gonna have to take these 4 teeth out and do an implant here and an implant here and do a bridge from there. So, I'm probably going to be somewhere in the low 40s, right? So I haven't calculated what that would technically cost too, right? So I'm going to be in the low 40s, and again, we're going to have a smile that I'm going to be able to match these colors up more to something like this. But still in the end, we got like a mishmash of basically different colors going on within his mouth. And so again, I'm not really happy about the aesthetics. The implants are looking great. He can most likely take these to the grave with him, so he won't have any more implant or teeth issues at this point. But I'm obviously not happy about the aesthetics. But here's the thing. My dad, he's 76 years old. He's got a low smile line, and what that means is that when he smiles, he doesn't lift his lips very high, so you can't really see the gum margin. But he's not he's not a vain guy at all. He really doesn't care about stuff like that. But the issue for him is that it's been such an exhausting process, right? And so having had it'll be 7 years, all this work done where it's like another tooth and another tooth and another tooth. So I got to look back honestly and I say, man, was this the right treatment for my dad? Well, we do a lot of all-on-4 here at North Texas Dental Surgery, and one might sit there and say, I look at it now and I'd be like, man, was I better off just having taken all my dad's teeth out and having done an all-on-4? Well, my dad says, it was funny because about a year ago I was actually just trying to get some photos and videos of my dad, just kind of document his case. And then my dad was like, I made this quick little video. I was like, this is what's going on is my mouth, and you see the discoloration of the different crowns or not matching of the crowns and all this stuff. And then I said something about I stopped recording the video and I was like, and I wish I did an all-on-4 on my dad. And my dad's like, yeah, I wish you did an all-on-4 on me too. And my dad says that again just because of the time of everything, the fatigue. And there's a very important point. I mentioned earlier that my dad's a family doctor, okay? So he's a physician, and he's not a wimp about things, right? So he is, always, referring patients over for surgeries, all that stuff. He's had medical procedures. But just, again, the whole, the fatigue aspect, it's just been very exhausting for my dad throughout this whole process. So I think that means something, right? Just because, again, my dad, for him, again, to have gone through this experience and say that I had done an all-on-4 on him, it does say something. But I do want to say something else. I'm not saying that basically you should take people who have some issues, so for example, a bridge on his upper left and then a tooth on his upper right, and say, okay, let's just take out everything and do an all-on-4. That would be extremely drastic, right? But I can, honestly tell you that I've seen so many patients that have had a few implants and they have a bunch of other crowns in their mouth and they have some root canals, and we're now having a discussion, all right, should we be looking at a more comprehensive solution beginning with the end in mind and understand that, hey, I do have a lot of crowns, or maybe I have some periodontal disease, or I have a lot of root canals that I need to kind of make a decision right now, because we don't want to. I use house analogies all the time. If I have some foundation issues and I may have some roofing issues and I have now had some structural issues, and again, I have had that history of the foundation issues, maybe I need to think of a more comprehensive solution that's going to give me a better long-term prognosis. And then also when we combine aesthetics involved too, because if I have to then address all these issues with my house and I put all this money in, and this house still is not, like, aesthetically what I really was looking for, maybe that there needs to be another solution, or look at like a more comprehensive solution where we take everything out and maybe look at something like an all-on-4, right? Because all-on-4s can look great, and also, structurally they're great solutions, right? And so I just present my dad's case as a testament as to how, if we don't look at the bigger picture longer term, and also when we take again a look at my dad's case and we say, hey, it only looks like it's his upper left bridge, but we look, we don't have that much bone loss, and we have a few other viable teeth. Hey, if we're taking out all these teeth, that sounds extremely drastic. And I totally get that rationale as to why taking everything out is an extreme option. But does it really make sense, where if you're going to look at this case, and say, wait a second, do I want my teeth looking like this? And then go through all the multiple appointments over all the years and have that fatigue, and then also look at the financial aspect of things, where maybe we do need to look at, all-on-4 as a more comprehensive solution that can be quicker, that may make more financial sense and look a lot better in the end, that's going to be a better option. And so I have another example of a patient, and she's been a patient of me for several years. We did some dental implants on her. She literally came in the other day, and let me show you her case. So here's her x-rays, and you could see she has, similar to my dad, root canals. She has a bad root canal on here that's causing her an infection. She has a bunch of crowns on her teeth, and she knows basically, and she has what we call a high smile line. She's in her early 60s, and she was like, do I need to look at a more comprehensive solution? She hates all the mismatching of her crowns, the aesthetics. She wants to have that beautiful smile. She doesn't want to live in a dental office for all these years. And so we discussed the all-on-4 option, because she knew she had some background information about it. We discussed it a little bit more, and we could sit there and say, hey, the all-on-4 might be a great option for you. Now, here's the deal. These crowns are like 15 to 20 years old, she says. So she knows that there's limited lifespan. Now, there's other people, other dentists out there, because dentistry is very subjective, and they may say, are you out of your damn mind, Dr. Choi? What are you doing talking about recommending these treatment options to these patients? Well, it's because that I've seen so many cases, like my dad's case, where they've gone and they've had issues with their teeth, their crowns, their root canals, and then they get all these dental implants placed. These are even some of my own patients that we've placed dental implants on. And then now we're sitting here 3, 4, 5, 6 years later, and we are starting to add up the amount of costs that we invested in all this, the number of procedures, and then we sit there and say, crap, did we do a disservice to this patient by not recommending an all-on-4? Well, here's the deal. I've been practicing for 12 years. I went to 3 years of residency, plus been in private practice for 12 years. I've done 10,000 plus implants in my career. And I've seen these patients over the years where we placed dental implants on when I first started in private practice. And when you see them now, because they had all these teeth just consistently eroding away, we're at 6, 7, 8 dental implants for some of these patients. And now they're just like my dad. We have no other option. We just need to continue going down that case. Now, I've also made videos about using existing dental implants for all-on-4, and I'm going to link that above and also the information below. But you cannot always do that. And in most cases, most often, you can't use existing dental implants. And long story short, is because they're too superficial. On a patient like this, where I just showed you her x-rays, she has a high smile line. And so we would have to, basically take the teeth out, smooth out the bone, and to basically hide that transition line. And unfortunately, in a case like this, we can't use those existing dental implants, but that's another video for another day. But again, going back to the point where we have to kind of evaluate the overall status of what's going on. Now, again, don't get me wrong. I'm not trying to be overly aggressive. We're not trying to say we got a bunch of like cavities and like small cavities in the patient's mouth and we're just trying to do all on fours. But do we potentially have a good reason as to why this patient should consider an all on four? Now, the way I recommend it is I always tell patients, listen, here's my main objective. My main objective is to tell you about the pros and cons of each solution. We can take off those crowns, assess what the viability is of all these crowns, and then start recrowning all those teeth. Now, if structurally they're not sound, then maybe we need to like take all those teeth out and then consider the all-on-4 option. The other issue is that you have a lot of existing root canals and you're having issues on some of your root canals. Could you investigate retreating those root canals, which don't have as good of a prognosis in the future? And then if you invested in retreating those root canals and putting new crowns on them, how much money are we going to put down the drain and not be able to achieve the aesthetics that we're really looking for also? And also, yeah, again, the financial aspect, the multiple appointment process, and also the aesthetic aspect. So patients need to consider all these options, and I tell my patients, here's the pros and cons of each solution, and I want you to make that decision for yourself. Now, before we go, I want to show you another patient that showed up to my office a few weeks ago. So here's this patient. She's 64 years old. She's got a bridge up here in the upper right, root canal, bunch of crowns up here, additional root canals, and she had some work done up in New Jersey. She had some dental implants placed, albeit poorly, experiencing a lot of bone loss around some of these dental implants. She never got crowns on there. Obviously, she can't smile. She's not happy about her aesthetics. And then what drove her into the office now was that she recently lost this tooth, right? And so she spent an insane amount of money already, definitely easily over $20,000, and she's not happy about her inability to chew, the fact that she's wasted all this money, not happy about the aesthetics, and then also knowing at this point that her only viable option is all-on-4. Well, unfortunately for this patient, she's now wasted all that money that she could have spent towards getting that beautiful, long-lasting smile and being able to chew again, and that's what kills her. You know, and that's what also frustrates me. One of my main objectives and why I'm making this video is that it's extremely frustrating, even for myself, when I see cases like where I place dental implants on and I sit there and I say, man, I wish I'd been able to see and predict what was going to happen and had that conversation with them earlier. But what we as dentists have to worry about, though, is that we have to walk a fine line because we don't want to seem overly aggressive when we're recommending these options, because again, the perception from other dentists, because this is subjective, is that, wait a second, why are you giving this option? Like everything's an all-on-4 to you guys, isn't it, right? And no, not everything is an, an all-on-4. But when we can see the transformation it can do, again, for my dad, where it was so frustrating with all the appointments, how I could have saved money, how he could have saved a ton of time, and in some patients who care about the aesthetics, that they could achieve aesthetics, then we become, surgeons like myself become very passionate about all-on-4 as being a great viable option. And so that's why I wanted to create this video, because again, it wasn't just my dad, it was other patients too, where when we see all these individual implants that are placed and use over time with all the multiple appointments and the money spent, you kind of feel guilty about it. And they're like, man, again, I wish I could have seen some of this happening. But again, we can't predict a lot of this stuff, happening. So I really hope that this information was helpful for you guys, that it can help you guys kind of assess before you get those individual implants or you get that additional root canal or that retreatment of a root canal or that crown, that you say, hey, hold on, let's take a look here. Let's see everything that's going on, and let's kind of like take a step back and say, what is my long-term plan? And again, I really think that if everyone begins with the end in mind and focuses on what their main goals are, then they can have a discussion with their dentist and investigate all avenues and then move forward with the plan. So hopefully this information is going to be helpful for you guys. If you guys have any questions, please feel free to leave a comment below, and I'll be looking forward to answering any of these for you. All right, thanks, and have a good one.